Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is July 25th, 2025. This video is on a Lancet Diabetes Endocrinology article published in 2024 titled Effect of Statin Therapy on Diagnosis of New Onset Diabetes and Worsening Glycemia in Large-Scale Randomized Blinded Statin Trials and Individual Participant Data Meta-Analysis. Statins reduce cardiovascular risk by lowering LDL cholesterol, but concerns exist regarding diabetes risk. Prior studies suggested around 10% increased risk of diabetes but lacked granularity. Methods: meta-analysis of individual participant data from 23 randomized controlled trials, 123,940 individuals, 21% with diabetes, median follow-up 4.3 years, compared low to moderate versus high-intensity statins and placebo. Outcomes: new onset diabetes, hemoglobin A1C equal to or greater than 6.5%, glucose thresholds, adverse events and medications, worsening glycemia, increase in hemoglobin A1C by 0.5%, and med escalation. Statistics: inverse variance weighted meta-analysis with the intention to treat principle. Subgroup and sensitivity analysis was included. What did they find? There was a 10% increase in new onset diabetes risk with low to moderate statins, relative risk 1.10, and a 36% increase with high intensity, relative risk 1.36. Glucose levels increased, hemoglobin A1C increased. 62% of the new diabetes in those with borderline baseline glycemia. So it's the borderline who tipped over. Worsening glycemia in diabetics, relative risk 1.10, and with low to moderate, and 1.24 with high intensity statin. Limitations of the study: variable availability of hemoglobin A1C and glucose data. Biochemical diagnosis was less frequent with low intensity trials. Key takeaways: statins cause moderate glycemic shifts largely in those already at risk. However, it's important to know that cardiovascular benefits outweigh diabetes risk. Clinical guidelines should reflect this. In the early cholesterol treatment trials meta-analysis referenced in the study, statins reduce major vascular events by 25% per 1 millimole per liter reduction in LDL cholesterol consistently across populations, including those with and without diabetes. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.